on the other issues of women's health, and I will be talking about ovarian cancer. Okay. The primary goal for ovarian cancer is detection, and really early detection. Ovarian cancer is sometimes referred to as a silent disease because early symptoms are mild and easy to dismiss. Ovarian cancer is cancer which develops in the ovaries, the fallopian tubes, and the peritoneum, which is the lining of the abdomen. There are over 30 subtypes, including low-grade and high-grade. Ovarian cancer develops quickly. It is the least survivable of women's cancer in New Zealand. It is a disease which impacts greatly on your family on whānau. One woman a day, one New Zealand woman is diagnosed every day with ovarian cancer. One New Zealand woman will die every 34 hours of ovarian cancer. 1 in 70 women will develop ovarian cancer sometimes in their lifetime. Now we know there's approximately 290 women here tonight, so 4 women sitting down this evening has the potential for developing ovarian cancer. Most women are diagnosed in their 60s, but it is not uncommon for women to be diagnosed in their 30s. Unlike cervical and breast screening and bowel screening, there is no screening program available for ovarian cancer. This is because it spreads easily, early, and it is difficult to diagnose. Now, symptoms of ovarian cancer are often not obvious, especially in the early stage, and can be confused with other non-cancerous conditions. So a number of you might have a number of these symptoms already, but that doesn't mean to say that you've got ovarian cancer. It could be just simple, you're fatigued, it could be because of stress from work, you could have gained a bit of weight over winter. Well, you know, that's just the extra food over winter you're consuming. You could have a backache, but that is because you've been gardening. It is not ovarian cancer. So the list of things that you can look for: abdominal discomfort, bleeding, pain in the abdomen or the pelvis region, eating changes, always feeling full, weight changes for no reason, a backache. You know, you could have gone to the chiropractor about your backache. Have you thought about going to see the doctor just to get your back also checked? Heightened fatigue, always feeling tired. May not be that second job that you're doing. Painful intercourse, abnormal vaginal bleeding, change in bowel habits, constipation or diarrhea, kidney or bladder problems. May not just be a simple urinary tract infection. Having these symptoms does not mean that you have ovarian cancer, but it's important that you get any changes checked by your doctor. You'll know that there is a number of nursing and medical staff here this evening, so if you wanted to have a quick word with a doctor afterwards or nurse afterwards, feel free to, but it's not a consultation, it's just a one question. You need to see your doctor. Okay. Women may present many times to a doctor before they're being diagnosed. You know, they've just got that niggly pain that's just not settling, or you're still feeling bloated. You just have to go back again. And you can see with the 4 stages of cancer here, where it starts in one ovary, then stage 2, it's gone to 2, and then it comes up your abdomen. Late presentations, and this is really quite alarming. 50% of women diagnosed late, and they are diagnosed in the ED department because they're presented late. They're presented with that, you know, swollen tummy they get with the ascites, the fluid in your abdomen. You look like a 9-month pregnant woman. That is a late presentation. A late presentation, you have fewer choices for treatment options, and your survival rate is much less. Okay. ovarian cancer, it can only be detected and predominantly one way, and that's with the ultrasound. So they have an abdominal ultrasound and then they have a transvaginal ultrasound, and that's exactly where it goes. Followed by that, if there is something of significance that is spotted on the ultrasound, you can have a CA125 blood test, which will confirm support the diagnosis. You cannot detect ovarian cancer just by the blood test alone. Treatment options are dependent on the stage of the disease, and they can be really radical. A lot of the inside is gone. Chemotherapy. It may not just be one lot of chemotherapy, it could be several lots of chemotherapy. This is a disease that affects your lifestyle. You could go through surgery, chemotherapy. Oh, well, I've missed the bullet to the big C, I'm fine now. You're clear. 6 months later, comes back again. This could go on. Survival rate for those at 5 years is only 40%. And support groups are very, very beneficial. You need support groups for not only yourself, for your family, because they're living through this hell as well. In summary, do not miss the warning signs. And before Angela comes up, and Nyoli, I just want to tell you about what is screening. Screening is different than a diagnostic test. Screening is your bowel screening, your cervical screening, your breast screening. So screening is what most people take most people take part in a screening program in order to reassure themselves that they are healthy, rather than the expectation that they are not. So screening is for healthy people. If you have got symptoms, that test actually becomes a diagnostic test. So there is a difference. Thank you.
Hello. We're the nurses, we doom and gloom talks. So my talk is quickly on breast cancer and breast cancer awareness. We all need to know can you hear me? Oh, I don't like public. Hello? Oh, okay. Okay. If there's something you can take home tonight, there's a misconception out there that you need to have a genetic mutation such as a BRCA1, BRCA2 gene, or you need a family history to develop breast cancer. The new stats out is 90 to 95% of breast cancers are spontaneous, which means anyone in this room can actually develop it. So here are some signs and symptoms. Oh, cool, sweet. So 1, a lump on the breast or thickening. So lumps might be found in the breast, armpit, or around the collarbone area. Cancerous lumps often feel hard, but sometimes it can just be thickening of the breast tissue, which feels different to the rest of the breast. Breast cancers will continue to grow over time. When you feel a lump in your breast, it's usually around 23 millimetres, and some of you in your goodie bag's got some little booby key rings, which is the size. A mammogram, if you have one, will detect a lump from 2 millimetres. 2, an inverted nipple. If you've had an inverted nipple from childhood, you don't need to worry, but if one of your nipples starts to retract inwards, this can also be a sign for breast cancer. 3 is nipple discharge, and this doesn't need to be blood stained, so it can just be a clear liquid, and it usually comes out of one of your nipples and you don't need to squeeze it. Oh, you're still on the right. Oh, yeah. 4, crusty nipple. Some women experience crustiness on or around the nipple. Sometimes it's like red rash or flaky, scaly skin. It may also feel like it is an itching or a burning sensation. A new crusty ripple, a new crusty nipple could be caused by eczema or using a new soap, but it can also be a sign of a rare type of breast cancer. 5, dimples, puckering or dents. Some women notice dimples, puckering or dents on their breasts. These can appear anywhere on the underside of the breast and could be caused by a breast tumour pulling the overlying skin inwards. 6, reddened orange peel-like skin. A change in breast colour with progressive reddening or inflammation needs to be checked out. The breast can be very swollen and usually feels heavy or achy. The skin is thickened and may look like an orange peel. 7 is shape change. So it's usual to have different sized breasts, but if you do notice that one of your breasts starts to shrink or the other breast starts to swell up, this can also be a sign of breast cancer. Please get this checked out. And 8 is unusual breast pain. So many women experience breast pain before you get your period. This usually goes away afterwards. So if that breast pain stays there and it does not go away, this is another symptom and you need to get that checked out. So just quickly, a few stats. So breast cancer is now the most common cause of cancer for females in New Zealand. It now affects 1 in 9 New Zealand women in their lifetime. Young women and men can get this too, and I believe it's around 6% if you're under the age of 40. So breast screening reduces your chance of dying of breast cancer, so it's around 30% if you're between the ages of 50 and 65, and it will protect you around 45% if your age is around the age of 65 to 69. So only 5 to 10% of breast cancers are from genetic mutations like the BRCA1, the BRCA2, or other genetic mutations, the PLP2 genes. So this means 90 to 95% of breast cancers are spontaneous. So like before I said, anyone in this room is at risk of breast cancer. So we do have a screening program in New Zealand. It is free for you to get a mammogram from the age of 45 to 69. And obviously, is it up there? Oh, sweet. If you're over the age of 70, if a mother or sister who developed breast cancer before menopause or developed cancer in both breasts, a woman has been diagnosed with a previous breast cancer or a previous biopsy of breast tissue shows an at-risk lesion, you can still have free mammograms after 70. Our national government will only fund a mammogram every 2 years. If you're in the audience and you're between 40 to 50 years of age, it is recommended that you have a yearly mammogram. So we do offer the service through Pacific Radiology in Christchurch who come over to Greymouth. If you want to pay for your mammogram every second year, there is a cost of $185. You don't need to pay that straight away. You can ring up, order your mammogram, and then after you've had it done, they will give you the bill that you pay at your own time. We recommend that you have a yearly mammogram because most breast cancers become quite advanced and are quite fast growing if you are between the ages of 40 to 50. Thank you.
I'm Nyoli, so kia ora ki te whānau. Good evening, everyone. As you see, I'm going to speak a little bit about cervical cancer and changes to the cervical screening program. In New Zealand, we're very fortunate to have the cervical screening program. This came about after the very unfortunate experiment and the subsequent Cartwright inquiry. We need to remember that that actually cost some women their lives. In New Zealand, since the screening program began in 1990, the incidence of cervical cancer has decreased by around 50% and the mortality or death rate by 60%. Our new HPV screening test is even better. It reduces the chance of you developing cervical cancer by 90%, and 50% of all people diagnosed with cervical cancer have not had regular screening tests done. Some signs and symptoms. Now, these may not be evident in the early stages, of course, and only 1 or 2. Basically, if you have any abnormal bleeding, any bleeding from the vagina between periods or after menopause, any bleeding after sex, any pain with intercourse, and any discharge which is not normal for you, plus a couple of other things you see there, then it's worthwhile getting that checked with the doctor. This is where our story becomes a good news story, unlike some of the ones before. So we have the new screening test, the HPV primary screening. This is recommended for all people in Aotearoa, New Zealand, who have a cervix and are aged between 25 and 69 and are or ever have been sexually active. The reason we say people with a cervix is that we need to acknowledge trans males may still have the cervix and therefore still require regular cervical screening. For most people, but not all, it will be a simple self-swab. Think a smart cotton bud with a longish handle. 10 to 12% of us will have a positive test result. Remember, most people have never been screened for this virus before. The positive test means we'll be asked to have a conventional smear, which we're all familiar with, and this is to check there's been no damage to the cervix. If there are any abnormal cells found in the sample, the person will be referred to the gynaecologist for further tests. 90% of us will have a negative test, and the new screening interval is now 5 years instead of 3. It was previously 3 years and 1 year if you're immunocompromised, so both have been extended out. HPV is the human papillomavirus. It causes most cancers of the mouth, the throat, the vulva, the vagina, the cervix, the anus and the penis, and some forms of genital warts. I regard HPV as a sexually shared virus. It's simply a risk of being human. All it takes is intimacy. You don't need to have intercourse. 80% of us will have it at some stage of our lives, and most of us will pick it up in our teens or 20s. Our immune system's super duper at that stage. It will generally clear it in 6 months to 2 years. If we get in our 30s or older, it can take 5 years or more to leave. And for some of it doesn't. Instead, it becomes dormant. It's a very sneaky little virus that goes and hides in other cells. We don't know who we are, but think chickenpox as a child, and 50 years later you get shingles. So in the meantime, there's been no symptoms, there's been no testing, and you've got no idea it's still in your body at all. In Scotland, to do with vaccination, this is where it gets to be a really good story. In Scotland, there have been no cases of cervical cancer in young people born between 1988 and 1996. The reason for that is that they've got a 90% plus vaccination rate of both the girls and the boys. They expect to eliminate cervical cancer very shortly. Australia is very much the same. In New Zealand, we're dragging behind that. We've only been offering the vaccination to the boys since 2017, and our current vaccination rate is around 48%. On the coast, we're up to 69%, which is really creditable, and it's free for everybody aged between 9 and 26, and women can purchase it up to the age of 46. After that, our immune system is less efficient and is not thought to be such an advantage in vaccinating at that point. So most cancers of the mouth, the throat, the vulval, vaginal, cervical, anal and penile cancers are due to HPV, and these are essentially all vaccine-preventable cancers. I work at sexual health. I haven't seen any young people with genital warts for probably 10 years or more, but I see 40-year-olds, so I feel that's got something to do with it as well. So in summary, please keep up with your screening. Your risk of getting HPV is the same at 17 or 77 if you have a change of partner. Don't ignore your symptoms, and please encourage anyone that's eligible to be immunised. This includes your children and your grandchildren.